Hi everybody. Today's episode is going to be all about trauma. It's going to be the hidden impacts of trauma on the body and how alternative therapies can help with healing. Welcome back to today's episode. We're going to explore a subject that affects millions of people worldwide, but is often misunderstood, and that's trauma. When people hear the word trauma, they usually think of extreme events like war, abuse, natural disasters, but trauma is not just about what happens to us. It's also about how our bodies and minds respond to what's happened. Today we'll unpack the science of trauma, what it actually does to your body, and then explore evidence-based alternative therapies that may support your healing and your recovery. So let's delve into the science of trauma in the body. Research shows that trauma is not all in your head. It leaves a physical imprint on your brain and your body. We've talked about stress before. So trauma can give you a stress response. When you experience trauma, your brain's alarm system, the amygdala, I can never say this, but it's the amygdala. It goes into overdrive. Stress hormones like cortisol and adrenaline, like we've mentioned before, surge. In a normal situation, your body calms down after the danger has passed. But with trauma, that stress response can get stuck in the on position, like a switch that's like turned on and can't be turned off. It affects the nervous system, and trauma often pushes people into what's called the fight or flight and freeze. The fight or flight or freeze. I've been talking about the fight or flight, but there's also the freeze. Over time, this can dysregulate the autonomic nervous system. Instead of feeling safe and connected, people feel constantly on edge or emotionally numb. It can go one way or another. So the brain, studies using brain scans have shown that trauma can shrink the hippocampus, which helps regulate memory. So trauma can give you memory loss. And the part that regulates your memory can make your amygdala overactive. And the amygdala is like basically the fear center. So there's one reason why people with trauma may experience flashbacks, nightmares, or panic attacks. I myself have suffered flashbacks because of certain events. Now, we all have heard before that the body stores trauma, but it stores it not just in the mind, it also stores it in the body. A concept popularised by Dr. Bessel van der Kolk in The Body Keeps the Score. Chronic trauma can manifest as physical symptoms, tension, stomach problems, chronic pain, and even cardiovascular disease. So trauma literally changes your biology, but there's hope. The brain and the body can also heal. So how do we heal trauma with alternative therapies? So let's look at ways people are finding healing outside of or alongside traditional talk therapy. There are sometimes called alternative or complementary therapies. Many of them now have growing scientific evidence behind them. So, somatic experiencing, developed by Dr. Peter Levine. This therapy helps people notice and gently release tension held in the body. Instead of reliving the trauma, clients learn to safely connect with their physical sensations, and research shows it can reduce PTSD symptoms and regulate the nervous system. There's yoga and breath work. Trauma often disconnects people from their bodies. Yoga and controlled breathing can restore that mind-body connection. A 2014 study in the Journal of Clinical Psychiatry found that yoga significantly reduced PTSD symptoms in women who had experienced trauma. The EMDR, eye movement desensitization and reprocessing, while not strictly alternative anymore because it is being used quite often, EMDR was once seen as unconventional. But the way it works is it uses eye movements to help the brain reprocess the traumatic memories. Now, I've trained in this and it really does help. So, randomized controlled trials show that EMDR can be as effective as CBT, cognitive behavioural therapy, in treating trauma. A lot of people use art and music. Trauma can be difficult to express in words for some people. So creative therapies allow expression through colour, sound, and movement. Research in Frontiers in Psychology highlights how art therapy helps regulate emotions and reduce trauma and symptoms in both children and adults. There's mindfulness and meditation. Trauma pulls people into the past, whereas mindfulness gently brings them back into the present, which, really is a useful thing to be in the present. Brain imaging studies show that mindfulness can strengthen the prefrontal cortex, the part of the brain that helps regulate emotions. We spoke about my diagnosis before, emotionally unstable personality disorder, which obviously comes from trauma. And that's when mindfulness and meditation help for me to reconnect. I mean, now people use animals. A lot of the time, equine therapy and animal-assisted healing are increasingly being used. Horses and dogs, are increasingly being used in trauma recovery programs. Working with animals can help trauma survivors build trust and a sense of safety again. Research has found equine therapy improves emotional regulation and reduces symptoms of PTSD. So if you're a person who likes to ride your horse, it's actually like therapeutic. Or when you have dogs, it's actually therapeutic. So putting this healing into practice. So healing from trauma It's never just a straight line. It's important to say that one size does not fit all, because not everybody can benefit from alternative therapies. Because what works for one person may not work for another. And like I said before, I'm not medically trained. Everything I tell you is from research or experience. And some people would prefer the traditional methods, because some people will benefit from traditional psychotherapy and need medication, while others find body-based therapies, yoga or mindfulness to be life-changing. The key is integration, combining approaches that calm the nervous system and rewire the brain and release trauma held in the body. And most importantly, healing trauma takes time, safety and compassion. So, to wrap up, trauma leaves a lasting mark on both the body and mind. But with the right tools, from somatic therapies, EMDR, to yoga or meditation, even creative expression, it is absolutely possible to heal. If you're interested in trying any of these approaches, I encourage you to look for certified practitioners in your area and always choose what feels safe and right for you. Remember, trauma may shape you, but it does not have to define you. Thank you for listening to today's episode. If you found this helpful, please share it with someone who might benefit, and don't forget to subscribe for more science-based discussions on healing and well-being. Until next time, take care of your body, mind and spirit.